Good evening. Joint pain and swelling have become more common today as people age. Pain in the knee can make even the simplest activities such as walking, running, or even sleeping very uncomfortable. To know all about joint pain and arthritis, we have with us today Dr. KP Kosigan, Senior Consultant Orthopedic Surgeon, Apollo Hospitals, Greens Road, Chennai. Good evening, doctor.
Good evening.
What causes arthritis?
Okay, like you said, with aging, people experience pain and swelling in the joint. So one of the most common cause is gradual age-related degenerative changes in the joint, and which is what is commonly referred to as osteoarthritis. தமிழ்ல மூட்டு தேய்மானம் அப்படின்றது வந்து that's what is referred to.
What are the symptoms of arthritis?
Symptoms of arthritis commonly patient complain of pain. This is what they come to us. Either it can be single joint pain or sometimes multiple joint pain. Now, when it is multiple joint pain, we then start thinking of another form of arthritis, which is known as rheumatoid arthritis, which is the inflammatory type of arthritis caused by certain autoimmune changes in the body. In Tamil, it's Mudakuvadam, and there are some blood tests for that. So, common symptoms: pain, swelling, because of which the day-to-day function of the affected part or the painful part gets affected. And most common thing being the legs, they complain of difficulty in walking. And if it's an arm, again, it's a question of moving the shoulders or elbows or wrist. And so thereby having difficulty with their day-to-day normal activities.
We have many questions from our viewers. Sir, my wife is suffering from knee pain and now she is taking joint-ace DN. Super. Please suggest your advice.
In the early stage of arthritis, first, of course, I assume she has had some x-rays or some initial testing to confirm that the pain from her joint is due to arthritis. And that certain types of arthritis has also been looked at. As I told you, one is rheumatoid arthritis. We should also think of checking bloods like for uric acid, ruling out rheumatoid arthritis. So for the basic form of arthritis in the early stages of osteoarthritis, whereby the function is largely preserved but pain and swelling, these nutraceuticals, which is what these supplements are, can be taken, and there are literature to support it. These what we call normally joint replacement supplements. Currently, the evidence is more in support of certain collagen-based supplements, which also has a similar constituent to what your wife is taking, joint-ace. But just check that if it has got some collagen-based supplement as well. If not, I would suggest you may change to one of these collagen-based joint supplements.
And how quickly does arthritis progress?
The common form of the arthritis, which is the degenerative arthritis or osteoarthritis, it's a more gradual progression. It's a very slow degenerative process due to certain internal changes in the cartilage, in its water content, in its collagen content, and it's a slow progression. There may be other forms of arthritis such as rheumatoid arthritis, which starts from the tissues surrounding the joint. It can progress in a much faster pace. Suppose if it's an arthritis or damage to the joint due to certain infection, this could be due to an injury in the past where some microorganisms have managed to enter into the joint. or some surgery which was done for this infection and some cleaning was done, these kind of arthritis can also progress at a rapid pace or a much faster pace than osteoarthritis. But in general, the age-related osteoarthritis is a gradual progression.
I have pain in my right knee. Doctor says there is a gap in the knee. Kindly suggest.
I assume again this he must have mentioned after looking at your x-rays that the x-ray is showing gap between the two bones which forms any joint, and particularly I guess your knee joint. Gap actually is good because it signifies that the cartilage which is between the two joints surface is still much preserved. When the gap narrows is when we say that the two bones have come too close to each other and they are rubbing against each other, causing friction and pain. So your doctor must have mentioned there is gap in the joint, meaning that the tissues or cartilage is still preserved, which is actually a good sign, or it's a good good prognosis.
I am 65 years old and suffering from osteoarthritis in both the joint knees for the last 7 years. Kindly advise if there is any permanent cure for it.
It depends on the stage of the arthritis you are in, and it also depends on the level of pain you have in your joint. If the joint space is preserved, like for instance in the knee, this is the top bone, this is the bone at the bottom, and these white and blue things are the so-called cartilage, which is actually taking the load and acting as a shock absorber. When the gap is preserved or is only mildly reduced, the treatment is the form of physiotherapy, cartilage supplements, and we also sometimes push injection into the joint, which we commonly refer to as lubrication, which can also minimize the friction. In situations where the gap is almost completely narrowed and the two surfaces are rubbing, which means these tissues between the two bones are almost completely disintegrated, you are looking at some form of a surgical solution as a more permanent remedy. So it really depends on the x-ray and to examine you what stage of arthritis you're in. And all the more important is also to confirm by this clinical examination and other investigation that the source of your pain in the joint is from arthritis. Because sometimes it could be a ligament tear or a cartilage tear or a pain in the joint referred from a different location.
My son met with an accident in July 2019. The MRI report shows complete thickness tear of quadriceps tendon, MPFL and LPFL with rotation of patella. Now he cannot even pick up his legs. What is the treatment? He is 17 years old.
July is 19 is fairly recent. Again, I will assume at least is in some form of a immobilization, either in plaster or a splint. Your report, the MRI report, is suggestive of a multi-ligamentous or multiple soft tissue damage. He must have had the kneecap dislocated and it must have gone back in. But as per the report, it's suggestive of damage to this side of the soft tissue, damage to this side of the soft tissue, and a complete tear of the quadriceps tendon. Now, this complete tear of quadriceps tendon does need surgical repair, because with a complete tear, the quadriceps tendon is nothing but the muscle which comes down in front of the knee, just above the knee, is a powerful workhorse for the knee. It has to generate so much force to get us moving forward, to help us to go up and down the stairs. And it is the main workhorse of the knee. And it is a complete rupture. It needs surgical repair. At the same time, we have to look at maybe repairing the other two structures which have been reported as damaged, which are just very close by on the side. Repair that also, followed by a period of immobilization in plaster, which I would say at least 3 to 4 weeks, and then a good physiotherapy rehab. And being young, I think once he goes through all this, he should be able to recover satisfactorily and pursue all his future endeavors, sports or other things.
My mother, aged 54 years, is suffering from joint pains in her knee, and X-rays show that there is mildly reduced femorotibial joint spaces, and also suggests osteoarthritis changes. What is the solution, doctor?
Again, when you say mildly reduce, it is mild to moderate degenerative changes. Depending upon the level of symptoms, if the symptoms are also mild to moderate, it is intermittent, and it doesn't affect the day-to-day activities, the initial step would be is to physiotherapy to strengthen the quadriceps muscle. If the pain temporarily is too severe, we can consider some safe analgesics to control the inflammation of the joint. Joint supplements, oral joint supplements, which she is not allergic to, can be taken. And the next stage, however, would be is to consider something more invasive. But before that, given that she's 54 and the joint space is not completely disappeared, I would recommend also to get an MRI scan to rule out any tear in the cartilage.
Who is more prone or who is at major risk of developing arthritis?
Well, certainly people who are obese, body mass index, high body mass index, with regards to the weight-bearing joints, which being the more common joints being the knee, obesity or overweight is definitely has got some relation, because the more load a joint has to bear during the lifetime, the more it's likely to get worn out. Recurrent attacks or episodes of gout, which is usually secondary to elevated uric acid in the blood, repeated episodes of such inflammation in the joint can also cause progression of degeneration in the joint. People who had a very bad trauma, injury which has involved the joint in terms of a fracture, they're also at risk of developing progressive degeneration in the joint. And to some extent, the rheumatoid type of arthritis can be familial or can be in the family history. Osteoarthritis, till the date, there is no genes or anything identified. Whether very common things asked is, my mother had arthritis, will I definitely get it? The answer is probably no. It's not like definitely you will get it. But in rheumatoid arthritis, there is some familial link, and also in other autoimmune diseases. For the more common osteoarthritis, obesity and lack of physical exercise can be considered as a risk factor.
How dangerous can arthritis be?
It is never dangerous. It is nothing like, it is not like a cancer or it leads to a painful condition. The pain sometimes disturbs even your sleep at night. The pain affects your day-to-day function, and thereby it can, because you're not able to pursue the same things which you were able to pursue earlier, or someone in your same age group is able to do, it makes you sometimes depressed also. But it's never dangerous. The osteoarthritis form only progresses slowly, and it affects your lifestyle and function, but it's never a dangerous condition.
Hello, doctor. I'm 46-year-old male. I have some pain in my buttocks, and I'm having treatment for the last 6 months. I also have an MRI and X-ray which are all normal, but the pain still persists. Kindly help.
Unfortunately, we do have to examine you clinically to locate the source of pain. Uh, you already had an MRI because I think the person who's looked at you was thinking in terms of sciatica, which could be one reason for pain radiating down the gluteal region to the leg. The other region which can cause pain in the gluteal region is your sacroiliac joint. This is a joint on the back of the pelvis where there could be some inflammation. So if the MRI is normal and there is no pressure on the from the disc on the nerve root which is traveling down the gluteal region to the leg, then we should look at other reasons for the pain. It could be a tendinitis around the gluteal region. It could be a sacroiliac joint inflammation. So I would suggest that you would need to be assessed clinically and correlate that with the X-rays and MRI you already had.
Is joint pain and arthritis interlinked to each other?
Not all joint pain can be termed as arthritis. Yes, arthritis is one of the cause for joint pain in anyone, but not all joint pains are arthritis. A joint could be painful due to other reasons as well. A very simple soft tissue strain or a sprain from a recent physical activity or unaccustomed activities, or an inflammation in the joint secondary to rheumatoid or elevated uric acid, or an injury which could have caused some damage to the cartilage or the ligament. So yes, arthritis is one of the cause of joint pain, but not all joint pain are synonymous with arthritis.
Hello, doctor. I'm 26-year-old female. I have a swelling in the ankle for the last 2 weeks and pain in my foot along with intermittent pain in the other leg as well. Is it joint pain or is it arthritis?
Your pain in the ankle and radiating to the foot. With regards to pain around that region, we think of commonly some tendinitis, which is also sometimes linked to being flat-footed. So we need to examine that area, whether your arch is satisfactory or you have a flat feet. Um, you can have an inflammation of one of the important tendons which travel around the ankle to the foot. And if you don't have any pain radiating right from the gluteal region to the leg, we don't have to think of sciatica. So pain around the ankle to the foot most likely could be a soft tissue inflammation around the ankle. We will evaluate it with an X-ray to look for is there any degenerative changes or arthritis in the ankle or the joint below the ankle. And if the ankle X-ray is absolutely normal, we'll do some blood tests and also MRI to start looking for inflammation of the tendons around the ankle.
Hello, doctor. I'm suffering from knee arthritis. Is there any remedy other than replacement?
It clearly depends on your age, the stage of the disease, and how much it affects you in your day-to-day function and your other medical comorbidities. If on examination of the knee and the X-ray images you have confirms what we call as stage 4 of the arthritis, 1 being mild and 4 being very advanced end-stage arthritis, if you're medically fit, then a better solution would be a knee replacement as a more permanent solution. If the X-rays or clinical examination show otherwise, then yes, we could think of the injections into the knee to lubricate the knee, physiotherapy, and temporary oral medications.
Many of our patients have questioned about having pain or worsening pain at night when they sleep in their knees and in their joints. What could be the reason, doctor?
It could be a muscular pain followed or due to the activity during the daytime. And during the daytime, in spite of having some pain, your mind is preoccupied with so many things, so you carry on with your work, and some of this pain shows up only when you come down to rest. So there may be an underlying joint-related problem, and because the muscle has to overexert and work during the day, accepting the pain, and some of these pains show up, yes, when you're sleeping at night. You can also have some kind of muscle cramps around the calf or around the knee, which may be due to a vitamin deficiency or dehydration or lack of stretching and exercises. So the pain which you experience at night, if it's more muscular, then it would benefit from taking some supplements, some physiotherapy, and exercise. Generally, the arthritis or joint-related pain, you usually will feel more when you're actually exerting the joint or loading the joint.
I have severe pain on my right shoulder. I heard it's called frozen shoulder. Even my finger joints are also paining. What should I do?
You need to be examined, and we need to do some tests in terms of X-ray and scan. A vast majority of the so-called frozen shoulder, which we see or which we get to see, sometimes does not end up being frozen shoulder. In frozen shoulder, your movement in all direction is severely restricted. On the other hand, what we most commonly see is a pain on moving the shoulder beyond a certain point or in certain angles, and sometimes when you're sleeping on the side, on the affected side. This is not actually frozen shoulder. It is more of a tendon inflammation in the shoulder joint. We also call it as subacromial impingement, where the two bones are rubbing close to each other. The pain in the finger joint could be unrelated to the shoulder problem, or sometimes it could be radiating from a neck-related issue, a minor disc bulge in the neck, which is irritating on the nerves coming to the shoulder and the fingers. Pure shoulder pain, not all of them is frozen shoulder. More common is tendinitis and inflammation of the muscles around the shoulder.
My elder sister is suffering from arthritis. She is 44 years old. Her whole body gets swollen, her feet and her fingers are bent, and she is regularly in unbearable pain. Currently, she's on allopathic medicine for the last 2 years, and her whole history of this pain and arthritis suffering is for the last 8 to 9 years. Is there any permanent solution to this?
Again, I would assume, given that it's multiple joints, relatively young age, and there is this associated swelling of the joints, that she would have been tested for rheumatoid arthritis and other types of inflammatory arthritis already. And I would recommend strongly, if she's not done already, to see a rheumatologist. Our role mainly comes when these type of inflammatory multiple joint problem don't improve with medication, then we may have to consider something more surgical. Given her symptoms and the history are given, I would suggest that she should see a rheumatologist specialist with the already available reports.
Hello, doctor. Why do people with back pain and spine pain and leg pain feel constantly tired?
There could be two reasons. One is the pain may be present even at night or even during their time of rest, whereby because of which they're not getting adequate deep sleep. So, they get fatigued during the daytime because of lack of adequate rest or sleep due to the pain. The second thing, they may accept with the pain, they will be probably continuing their day-to-day activity, coping with a lot of pain, and yes, towards the end of the day, they may feel more fatigued because they're putting that extra effort to cope with their day-to-day activity. And common, before putting everything due to their back or hip or knee pain, why they're feeling tired or weak, they should get a general workup as well. Just look at the other causes such as vitamin D deficiency, or look at their thyroid status, and a general medical checkup also look at a different angle apart from the joint pain as being the cause for their tiredness.
I have an ACL surgery 2 years back. Now, can I play cricket or start running or jogging? I still have pain in the lateral knee. Please suggest.
Just get yourself reassessed by the surgeon you perform the knee or some other consultant. If you have rehabilitated well following the ACL surgery and your initial symptoms of instability is not there and the knee feels strong, certainly in my category of patients, I do let them go back to playing sports at whatever level they've played before. And it's always a good thing to start off with a small jog or a run and acclimatize before you go on to full swing, what we call as a graduated return to sports. You say you still have a lateral knee pain, that I think you should get rechecked, because it is not uncommon when you have your ACL ligament injured to have associated meniscal or other ligament injury at the same time, and we need to make sure that that is healed as well.
My wife is suffering from polyarthritis diagnosed at a hospital since in 2013 and was under control. But suddenly she has acute pain which rises on her left hip, and doctor has referred to an orthopedic who suggested to replace the hip bone, which is impossible as she has already removed her left breast due to cancer. Is there any alternative to live without surgery?
We have to look at the x-rays. If the hip joint, ball and socket joint is severely affected, then the hip replacement would be a better solution. Now, when you say it's impossible, we need to see how well she had recovered from breast cancer, because as you know, the outcome following breast cancer has improved significantly, and most people have a normal recourse to life. So we do need to check with the oncologist and the breast surgeon, why would she not be a candidate for hip replacement? And of course, we have to see your x-rays and or MRI if you've done, to see what stage of the degeneration or damage the hip joint is. In a very advanced degeneration or in a very severely damaged hip replacement would be the option, and they usually do well. So just don't purely write it off because of a previous history of breast CA. Check with the cancer specialist who treated her in terms of how well she's doing from it.
Are there any good multivitamins to take for joint pain, doctor?
Not multivitamins exactly, but we do use the joint supplements, what we call the nutraceuticals, what we commonly get off the shelf, and people may be familiar is the glucosamine and chondroitin. But I use now more of the collagen-based, type 1 collagen-based supplements. It comes in the form of a sachet. You can mix it with water and drink it, or even like a gel capsule once a day. And it's been proved to be very safe in terms of clinical efficacy and safety. And I tell my patients you can take it as 3 months on, and then you can have a 3 months gap. So roughly about 6 months in a year. But very young people may not need that. It's merely for the early to moderate osteoarthritic group in the mid 50s or postmenopausal in women, but not necessarily very young people.
What is the root cause of arthritis, and is it true that it occurs not only in old age patients but also in youngsters today?
We see joint pain and joint pain related to arthritis across all age group, like someone even as young as 16 or 17 can get arthritis from a condition called juvenile rheumatoid arthritis, and the same rheumatoid arthritis can affect in the middle age or later as well. But generally it tends to affect the middle age in the second and third decade. And of course, the gradual onset osteoarthritis. We also have injury now leading to cartilage damage, which can also cause arthritis in a younger age group of people. And then other metabolic issues and deficiencies, as well as recurrent episode of this uric acid which can damage the joint. So we see this across all age group. In a very younger age group, it could be one of these autoimmune diseases or rheumatoid type of arthritis.
Are there any specific foods that can help avoid arthritis and joint pains?
Nothing particularly. You need to, of course, watch what you eat in terms of not putting on too much weight, not becoming obese, because we know that is a big factor in at least the weight-bearing joint as one predisposing factor for arthritis. If you already had 2-3 episodes of gout or high uric acid issues, you should check with a nutritionist what is actually a low purine diet. For some people, it may be dal. For some people, it may be, say, certain fruits. For some people, it may be meat. So you do need to avoid if you have a tendency to frequently experience high uric acid levels. And of course, you're diabetic. You need to take the right precautions to avoid, make sure your diabetes is under control. But in terms of osteoarthritis directly, there's no specific food linked related issues.
When should one visit the doctor? Many of us apply anti-inflammatory gels or maybe take paracetamols and avoid consulting a doctor even if we feel it's a little serious. When should we consult a doctor immediately?
I think when you have experienced a joint pain, you can wait for a few days. If you feel your recent activity may have caused it, you can wait for a few days and apply topical gel, which you're aware of. You can use the topical gel, ice it, and avoid too much strain to your affected joint. But if the joint pain is persisting in spite of you taking the load of it, as well as giving it some rest, and it is present even at rest, I think you should consult a doctor to at least undergo a clinical examination to a start, and a minimum is an X-ray of the affected joint, just to make sure there is nothing structurally affected underneath.
What is your message for our viewers today, doctor?
Joint pain is common, as we mentioned in the start. It is affecting across all age group. Not all joint pains are always due to arthritis. There could be other reasons for it. But if you have joint pain, don't be too much disturbed about it or don't get depressed about it. There are various treatment options available. Not all of them surgical. So don't worry that if you go to a doctor, you will be always advised on the surgery. At the same time, don't refuse surgery if you are in the end stage of the arthritis or the joint is severely damaged and if it is affecting your quality of life. Make sure you do some regular physical activities as per the capability of your age. Maintain a good diet and seek help when you think the pain is persisting, beyond tolerable limits.
Thank you very much for a wonderful session, doctor. For appointments with Dr. Kosigan, please connect at 044 2829 6719. I repeat, 044 2829 6719. Thank you very much, doctor. Thank you, viewers.
Thank you.